everybody since I've been here this morning? How do you feel?
I feel overwhelmed, wonderful. My heart is overjoyed by the participation of the financial institutions, the people offering housing solution, and the overall coordination by the National Housing Corporation. Incredible thanks goes to that organization, Ian and Fiona and the team there.
Any gimmicks to making getting a house easier by the hospital or from any of the lending agencies or the finance companies?
A couple of agencies have actually looked at their lending rates. Some agencies are looking at prioritizing hospital and other essential workers. So it is recognized that part of what many employers need to do to make staff feel valued, appreciated in such difficult times is to do activities like this. So the private sector themselves are actually responding. For us, what we recognize we have to do is educate our workforce, because one of the things that the financing agencies, National Housing, has told us is that people need to understand about spending, they need to understand about saving, they need to understand how to prepare to get a mortgage. So in addition to what you see outdoors here, we're actually doing financial planning sessions at various intervals on the inside. And the Hope Incorporation is doing one-on-one sessions with persons who have applied so they can understand where they're at with their applications and address any outstanding issues.
Are you going to do this again, or will you do it again?
It takes a lot of resources, and as I understand it, there are other agencies who are crying out for similar, so I'm not sure we will do another event of this nature. But we have, this is part of a whole program called QEH Cares that we're rolling out as a board and an organization. So this month we focused on housing solutions, providing our staff with the information. Next month we're moving to the issue of insurance. We want to help our staff understand what the marketplace is out there for health insurance, housing, car insurance, so that we can get the best rates for Queen Elizabeth Hospital. We are adamant that if as an organization we do these kinds of initiatives to build and uplift and support and show that we value our staff, in turn it's going to redound to the benefits of our patients, because happy staff means excellent patient care.
How many lives do you think you'll touch in terms of head count of the QEH?
We have 2,500 staff between the head compound here at Queen Elizabeth Hospital, Harrison's Point, our annex in Belleville, and our assessment center. We're actually the largest employer in Barbados, and we have the most diverse workforce, from entry-level staff to the most technical staff exists within the hospital.
Are you happy the way things have gone?
I'm very happy. It's our first time doing something of this nature. And again, I emphasize the coordination role of the National Housing Corporation, because they do these fairs. They do them so excellently. So it was just a matter of saying to them, here, we have a captive audience and we want the opportunity. Our staff work some nice 12-hour shifts. So sometimes a lot of national activities are actually missed because of how people work. Bradley can tell you. And so essentially, by bringing it here on the compound, the staff that came off this morning at 7 a.m. actually held on until 8. So they came, they were able to access the information and go home and sleep and return. So we're really doing it to facilitate staff, and they've responded extremely well.
Well, I walked in the middle.
Hi, Trey.
How are you doing?
I'm fine, thanks.
How many nurses, from what you know, came through today?
We didn't do a head.
Staff nurses.
Yeah, we didn't do a head count, but we have about 850 nurses of different categories at the hospital. I'm very familiar with the uniforms and the faces, although most people have on masks, and I can see a heavy complement of nurses came through. They are the largest component, so unfortunately you will see a lot of nurses because they're just the largest number. For us, the reason why we're taking a special emphasis on nursing, we know that here at QEH we're competing with international actors. The recruitment drive for nursing globally is on, The National Health Service is short of, I think I saw figures more like 54,000 nurses or something significant. So for us, we know that Barbados is one of the best places to live and educate your children. So if we as a country and as an organization can provide the opportunities for nurses to earn a living and see their way to own a home that they can pass on to their children, we feel those kinds of initiatives will help us retain the staff at the hospital.
Madam, any challenges to pull off this operation today?
You're doing it, it's a balancing act between providing access to the event and ensuring that patient care is continued. So on the wards, the nursing department and other departments are basically phasing how people come and go so that we're able to continue services. And from what I see, the staff are able to come, access, get the information, and return to work. And all credit to the swift pace of which or exhibitors are providing the information. So the biggest challenge is balancing continuity of services with actually allowing the staff the time to see. So that is why the span of the event is from 8 a.m. to 4 p.m. because we're going to span all of the major shifts during this time.
Thank you very much.
Thank you so much.